Do you suffer from debilitating joint pain, maybe from an injury or arthritis? Have you been told you need joint surgery? Well, wait before you do anything. I have been invited to Phoenix Spine and Joint to meet the doctors here, and I'm with Dr. Nathan Moore, and I have to tell you, I'm a little intimidated. Where are we right now, Dr. Moore?
Yeah, this is one of our in-house operating room suites.
Okay, this piece of equipment, though, is a little scary. What is it used for?
It's a hip replacement. Yeah.
Okay, I know very well about hip replacements.
Yeah. and particularly a minimally invasive approach for hip replacement, the direct anterior approach.
Okay, so before we talk about that, I want to talk a little bit about what you guys specialize in here, because it's not just about surgery, it's really about the patient experience. People can come to you who don't need surgery?
No, absolutely. We like to focus on the entire patient experience, and that starts with a phone call. It starts with the first several visits. We determine if the patient is, a candidate for surgery or if they need conservative care. Quite honestly, it ends often in conservative care, and we're able to determine that. And I like to think that we, as surgeons, physicians here, can help coordinate a plan with the patient to decide which way is the best way to go.
I like that a lot. All right, let's talk about surgery. If by chance you do need surgery, you have said to me, you know what, you want to make sure that you have somebody who is experienced and knows what they're doing. That's what the doctors here at Phoenix Spine and Joint provide?
Absolutely. Experience is key. Someone who's done many of these procedures, particularly an expert in that exact field that you're looking to have treated. For example, shoulder, knee, hip, back. A specialist that's had added training in that field.
You also use a lot of technology here, specifically robotics, and it can be a little intimidating to the patient. It's like, you mean a robot's doing my surgery? But that's not really the case, is it?
No, absolutely not. A lot of people wonder if the robot is doing the surgery for you, and that's ultimately not the case with the robot that we utilize. This robot is more like an assistant. It's really like an added set of hands, someone that can help guide the instrument into the exact position, placement, and accuracy that's unprecedented, really.
You use other technology too, like creating 3D models and things like that. Why is that important to me as the patient?
Well, if you think about it, we can go into the surgery preoperatively with a plan. The patient's 3D image of their joint is already there, and we can actually place the implant in that position, move it around, decipher what sizes that patient's going to need. So ultimately, this creates a unique surgery through this process.
One of the other things that you guys are very proud of, and our viewers are going to now know why, is that you do all of this in-house. A patient can come in at 7 o'clock in the morning and go home at 11 that morning?
Absolutely. No longer are those 3-day stays in the hospital necessary. I mean, this isn't your mom's knee replacement anymore. So ultimately, you can come in at 7 in the morning and be gone before lunchtime.
That is crazy. And that's important for so many reasons. We are in a pandemic. What are some of the safety issues to us as a patient of going home that day?
Well, a lot of people wonder, can I even have a joint replacement outside of a hospital? Because traditionally, that's always been how it is. But absolutely, we use different alternative techniques in anesthetic care to provide the pain relief that's necessary for people to still be able to go home same day. And we utilize minimally invasive and particularly muscle sparing techniques that allow for that same.
So faster recovery, less
downtime.
Real quickly, with robotics, are all patients a good candidate for that?
I would say absolutely. If you're a candidate for a total joint replacement, you're typically a candidate for robotics.
All right. Like you said, it's not your mama's joint replacement anymore. All right. Thank you very much, Dr. Moore. Here's more information. Phoenix Spine and Joint. They have 3 locations: Scottsdale, Goodyear, and Gilbert. Call 602-256-2525. Learn more. Visit the website phoenixspineandjoint.com.